Do we have any visitor comments?
She just admitted.
Oh, we recording? Yeah, I did. I just did.
No.
Okay, so seeing as we have no visitors. I haven't.
Can you pull up the minutes?
Yeah. We all looked at the minutes and I looked at it a while ago, but I am not thinking about them right now. Can you? Sorry. Anybody have any things they wanted to change or are we good as far as the minutes go? I would entertain a motion to approve the minutes.
Madam Chair, I so move.
Okay.
I'll second.
Okay. It's been moved and second. Any discussion? Okay. Everyone in favor of approving the minutes, say aye.
Aye.
All those opposed, say. Okay. Okay, are there any additions or changes to the agenda?
Madam Chair, I would like to change the budget fiscal year 2025, 2026 to the monthly financial report from Tish.
Okay. Okay. Is that anything else that needs changed?
No, but my comments for the budget will be during the discussion time.
Okay. So I would,
Sorry to interrupt. I cannot keep a good connection. You are recording.
I am.
I'll get it tomorrow.
Okay.
And I apologize to everybody.
Well, us too. I don't know why it's not working for you. Sorry.
Something's not letting me get a good signal.
Yeah, that's our fire alarm.
Yeah.
That's our fire alarm. So
what does that mean that we need
wait,
to?
well, the truth is I gotta go down and check on what the alarm is for. So
Keeps doing that.
yeah.
Right, Mike.
You're all right.
Yeah. I thought it was only me there for a moment.
Just change the agenda.
Do you have
Monthly
what you
financial.
doing off in here that was just fired?
Yeah, I never lost it.
Yes, she changed, she wanted to change it from, she wanted to talk about the budget here.
You guys have a
And do
good
monthly
evening.
financials.
Bye, Walter.
Bye, Walter.
Thanks for
Thank
coming
you.
for dinner.
Got to eat anyway.
That is piercing.
Yes, it is.
No, but it was a fire alarm.
Yeah, it sounds
No,
like
it's
a resonant alarm, like a door alarm.
Shane said it was something over here. Well, that's a different.
That's worse.
Wrong alarm. Sorry.
So what is it?
That's a wanderer.
Yeah.
So alarm. I went to the alarms and they were all normal, thank heavens. So
Yeah,
That's what Shane was. Yeah.
Kim reminded us that it was.
oh yeah, usually strobes or something. Yeah.
It's gone now.
Yeah, some sort of attack. Hey, thank you. Sorry.
That's okay. Okay, so Kevin wanted to change to put number 2 under finances to monthly financials and to add the budget discussion in with the budget discussion that's already headed there. So is there any other changes or additions to the agenda?
Madam Chair, I make a motion that we approve the agenda as amended.
Although, any discussion? Okay, all those in favor to approving the agenda, say aye.
You seconded.
I did. Corinne did. Thank you. All those opposed, the same? Okay. Okay, so now we are on to the quality committee report, which I didn't forewarn you, Mary, but actually Kim's first. Oh, there you are.
It'll
right
be
there.
short, sweet, to the point. We didn't meet this month,
Oh,
for the Yellowstone conference, so we didn't meet. But I do have credentialing, so I've got 3 providers tonight. Dr. Helms with Blue Sky Neurology, Dr. Schraubauer with Cardiology, and then Jan at the clinic.
How does that work with not having the executive session?
We do that. Oh, yeah, I didn't think about that, the executive session. Well,
Wonder, do
we guys used to just approve them, but they've gone through committees,
They've
right?
gone through med staff
All the-
already.
Yeah, they've gone through med staff already, and
There's no concerns in them.
so you can just look at them afterwards or something.
I'm shocked.
Do we have to have a motion to
First
approve
meeting.
them?
Yeah.
First
Can we
one.
do it in quality here?
I thought it was.
Is the board fine with taking a look at them now and we'll just make a motion now?
Sure.
Is that fine?
Mhm.
There's nothing concerning in any of them.
So I make a
We'll discuss
motion
privately, so.
that we approve the credentialing for Jan Mason Manzer, PA. Kathy Helms, MD.
HELMS, Kathy with a K. Dr. Helms is a new initial, with Blue Sky, but everybody else is no age.
Yeah.
Katie.
MD.
She's neurology. She does our telestroke.
And Alexander Schobauer. I'll let you look at that one. Do you want? Alexander's good. SCHAEAUER. MD cardiology.
Katie Helms, MD.
Yes.
Yes.
And Jan is PAC. PAC certified.
Sorry. So I had no, you're right.
She works like PRN.
Well, we're gonna ask her if she's going to do that or not, because I haven't seen her since she retired, but they tend to sometimes linger for a little while to make sure we're okay, and then they.
Get up there.
Mhm.
It's hard.
Mhm. Yeah, it's hard.
His building is cut out.
No, she does.
This is the first place I've ever worked, just for you to know that the
I think
CEO
we
doesn't
need a
sign them.
more than the high school photo.
She's a
Okay,
caretaker.
yeah.
She
more-
does. But everybody more looks
Yeah,
like
I'll mention it.
children, and I don't mean that in a bad way. It's my eyes are getting old.
I'm just trying to remember whether
When,
it's been a
pediatrician came in.
Yeah.
new beauty. Like I
It's
don't.
the only thing, I
Oh,
don't,
God.
the only thing I can
I
speak
used
to is that
younger
every
than
hospital I've been in,
Yeah.
I have to sign off on this, because there's a part of it that says that I can decide if there's an emergency or something I can decide to either approve them or to,
Well, you have to sign up on the temp privileges, so it makes sense to only do.
Yeah. I usually look at them. This is the first place I've ever not. Not that I want more to do.
Doesn't that leave you a liability for your
Yes, yeah. Yeah.
That watermelon is sweet.
Okay. Okay.
Just like. Nurse practitioners and PAs both fall under that title. Right, so maybe so you don't get them confused.
I was wondering if you're the first person. I don't know what to ask.
The Motion carried. Majority.
Yes, I made a motion to approve the credentialing. Like, three people, Jan Mason Manzer, Kathy Helms, Katie Helms, MD, neurology, Alex Schobauer, MD, cardiology.
And do we have a second?
I'll second.
Any discussion? All those in favor say aye.
Aye.
All those opposed, same. Okay, so those are approved, taken care of. Now. Anything else?
Nope, that's it for me.
And Mary, you, since the meeting was canceled,
We
you
don't
don't
have,
have
I
anything?
don't have a report.
Making it easy tonight.
Okay, so we're up to Shane next.
Okay, current census is at 51, so May we averaged 50, so that's great to see. May we had 4 admissions, 1 discharge, and currently we have 4 referrals. So our star ranking hasn't changed at all, still is at a 3-star overall. So staffing wise, we're down to 9 staff, our agency. We have 2 nurses and 7 CNAs as agency. We have an interview with the LPN tomorrow, actually, and then 2 CNAs next week. Currently, I think the number I have may be actually higher now after our meeting at 3:30. I had us at 7 CNAs in the class that were interested in the Manor, but I think it's gone up 1 or 2.
Wow.
Yeah, I think it's
So it's good.
Yes, yes, very good.
We've got about 4 to 5 that are really close to getting licensure, so hopefully.
Super awesome.
Yeah, and then we have 2 CNAs that are starting in July that will be our own, so. Yep, headed in the right direction there. And then Medicaid pending, that has dropped some too for us. We are down to 6 overall. 1, everything is in. We're just waiting for the green light. And the other 5 is we got stuff in and we're working through the process. So improving on all those fronts.
And we got a bump in our payments, Medicare, Medicaid payments. Yeah.
Any questions for Shane?
No, this is pretty big improvement since you got here and all those things, so just like to acknowledge that.
That is fantastic.
It is.
Okay, we'll move on to the finance committee report. Carrie, are you ready for that?
Yes, so in finance committee this month, we had a heavy discussion about the budget and the different options available, and Kathy's gonna cover a good lot of that in her report. We did talk about consolidating some of the bank accounts, and Tish is gonna get some more information on that before we bring that to you. We're gonna explore that again next month once we have more information. We talked a bit about accounts receivable. We're not seeing a lot of changes in our accounts receivable. It's not heading in the right direction still. And we do have a consultant that was approved by the board last month, and they're gonna start to look into that. And I've asked Kathy to take in a couple additional steps so that we will be able to get a plan to the board, or at least some more information in the next couple months on different options that we have to improve our accounts receivable.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, There's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donut. It's amazing what this area has done. Totally amazing.
Can I ask, when is that consultant gonna start?
Monday.
Perfect.
The rest of it will be covered in Tish's report and Kathy's report, because the bulk of our discussion was around the budget this month. So Nathan, anybody have anything to add?
I think that was a good summary.
Go ahead. Okay. We had our meeting with the auditors, Daniel and Catherine, and things are progressing forward quickly on our 2024 audit. We have a weekly meeting to go over any pending items. So right at the moment, so it gives me 5 days to get every new request back to them. So we're moving right along. We don't have any outstanding items that I haven't returned at this point. We had a meeting with Ready Health and Monument regarding our charge master review, and we were able to have Monument's report programmer present. And so they were able to come up with a report that was acceptable to Ready Health. We should be seeing the proof of that within 2 weeks. Ready Health anticipates that they'll actually be able to get started in 3 weeks. It is a 6 to 8 week review. But so we will still meet our grant timeline, which is the flex grant plays for our charge master review. So everybody is aware of that deadline and is working hard to get everything done through then. The cash flow is we are still increasing slowly but surely, steadily, no big, on improving our cash. We actually had payroll covered on Tuesday. It was great. Hasn't happened in quite a while. We are keeping a good look on accounts payable. Staff have totally embraced the new processes, not only with the inventory, but within the new approval process on the limits of spending. So we can keep a little closer eye on our expenses. And everybody seems to be very willing and able to work within those parameters. So that's kind of a good team building and helps us save money all at the same time. Our inventory system went live on June 2nd, and everybody seems to be doing rather well with it. We've had no big, huge glitches. It does work its way through the general ledger. So when they order, we can see that it reduces inventory and it charges to the departments. On now, we are averaging about 24 to 32,000 a month in supplies is what's being ordered by the departments.
I'm sorry, can you repeat that? 24 to
Between
32?
24 to 32. And that is varying on census. So.
And it's going through like it's supposed to. And
Yep.
charging, and
Yep.
getting that.
Yep. And so we're getting a little more into the fun bells and whistles, so we can have, like if I was gonna be leaving, I could delegate someone to approve the orders so they don't just sit there. And so we're able to make the inventory and the purchasing options through all the departments flow better. So there isn't like, well, there isn't anybody here to approve my order, so I've got all these urgent orders. So we have delegates we can give. So it's a nice feature. And Jason, Chris, and Stephanie have done a phenomenal job. And they are working closely with the scanning company. There's a scanner, you can push a button, it brings up the requisition. They can go walk around with it. It fulfills the order, they stock up the cart and off it goes. So it's all paperless. And so it seems to be working very nice and everybody seems to be on board so far. Kathy and I met with all the department managers and directors to go over their P&Ls and what they needed for the budget. So it was very refreshing to meet with all the department managers and see how totally engaged they were and how they really wanted to be a part of that particular process so they could have some say in how their departments are moving forward, additional service lines. It was just very refreshing that this is something that they were actually looking forward to participating in. Sometimes that doesn't always happen. But so it was very refreshing. On our cash flow, we can go ahead and see that. So I wanted to bring, so this is a learning process for everybody. It's a complex form, pulling the data from other reports and other softwares. It looks like this. Do you need another?
I
don't have a
I don't have one.
You don't?
I don't.
I have one on my computer, but not on my.
Here, there you go. I think I'm out. So we made it. No, I made 10 copies. Does everybody have one? Oh, yeah, that's mine.
Oh, you memorized all those numbers.
Yeah, no, can I
Okay.
have that back, please? Thank you very much. I wondered where that had scurried off to. So we have, so I'm training staff to do this, so that will be, so we have some redundancy in our, the cash flow, and so they can become familiar with where numbers can be found and things like that. So that's been a good process. We did actually transfer, we reversed a formula on the increase decrease cash, and we're going to take out the red. They decided that the red was too jarring, so it's just going to have parentheses around it, so it'll all be a black and white report. You can see that we added a feature at the bottom. So we had discussed it in finance at a month or so ago. And what we decided to do is we would put cash on hand without the money market account and without the CD. So we have 32.41 days cash on hand. If we take in consideration, including the money market account, we have 46.34 days. If we just use the CD, we have 38.04. And if we include the CD and the money market and the bank accounts, we have 116.77 days cash on hand. So that was, it gives us a little more broad spectrum of how much reserves and assets we have in the bank. So.
Can I ask a question?
Go ahead.
Is that an accurate statement? The salaries and benefits was exactly the same from April to May?
Yes, it is. Yep, it is. And we confirmed that through ADP, not through the accounting software.
So what accounts for the decrease in 141,000 cash?
Oh, what we did was we took some funds out of the money market account for the donations, and we had additional spending. So we did pay off, we did order something through the, for the CT, and I don't remember the exact cost. We had some other reductions. We paid, $1 million with, AP bills that we paid.
Well, where does that reflect on the report?
It reflects in the checklist. It's non-payroll related expenses.
So Tish, I think the confusion is, I'm also confused. So for May, we begin the month with the prior month total cash.
Yeah.
We all see that 3.128 and 890. Then we have inflows, we're missing commas, but we have inflows of 1.88 million. Then we have total outflows of less than the 1.88, which means our cash should be increasing, not decreasing.
Right.
And so the end of month total cash should be beginning plus the increase for the month. And that's where we should be hinting.
Yes, you're absolutely correct. And I'm sorry, I didn't notice that the last 2 months didn't have any commas in them on the
Right,
total.
but still
And the formula is
there's
backwards.
still continue to be math, basic addition errors, which I think is probably confusing
It's definitely
the
confusing.
readers.
This is not a very easily comprehensible form. It's not easy at a glance.
I think
I know you like it.
it's very comprehensible to say we started here.
Yeah.
Here's the pluses, here's the minuses, and here's where we end up.
Okay.
All I'm saying is there's continuing to be basic math errors.
Yeah.
And that's causing the confusion. I think the form is a very nice.
So can I ask, cause I am trying to understand how we get to the number, the decrease in cash of 141 if we
That's
had.
a math error.
That's
Okay.
the formula error is backwards. We're
So
taking
it should
something
be
away.
a plus.
It should be a plus.
Okay.
So it actually gained $141.
$41.
Okay.
Yeah.
Is
For
that
this
true
month.
for April and March also?
Probably.
Yes, it is.
That those are actually supposed to
So
be
October and
increases.
November should be
Correct.
minuses, and all the others should be increases. Is
Yep.
that what it's looking like?
Oh, I see. So
So if you look,
it's backwards of,
Right. It's taking the wrong number from the wrong number.
okay.
From the wrong row.
Well,
So when we
Right.
go across the increase or decrease cash line, everything that's actually currently in red is actually increases.
Correct. They should
And
be
the two
black.
in black should be the red ones that are decreases.
Correct.
Okay, thank you for that.
And they will be restated with explanations at the bottom for next month, or I can redo it afterwards, doesn't matter. We can resend them out, whatever the protocol is.
Please forgive me if I'm wrong here, but the math doesn't work even then.
You're right. The ending cash is 3.2 million, not 3.3. So the end of month total cash number is also not mathematically correct.
Right. And if you take total inflows and subtract total outflows, it's
Right.
81,000,
It's 81,000.
not 141,000.
Yeah.
there's something wrong with that.
There's something wrong with the formulas in there, so I'll go ahead and, I started working on it today. I apologize for not completing it. I'll have that restated. So, we have the accounts receivable. We're gonna be adding more, data on the accounts receivable. Larry had made a request that we include the dashboard. So, I just need to make sure that we have all the adequate reports that are needed. So as you can see that our accounts receivable days did go down. Accounts receivable days by location, we have reached out regarding the Manor clinic visits. We seem to be having a disconnect there. Dr. Franklin has stated that he has completed all of his documentation. It is not at the desk who it needs to be. Sandy is usually the one that does that. She doesn't have those records, so we're trying to his numbers. So we're trying to find those. Home health went up slightly, but they did have an increase in patients as well. The clinic went up slightly in days. The hospital went down. And the Upton Clinic, we are waiting for approval for enrollment for Dr. Akers in Medicare. We received another denial. They were inquiring regarding his telehealth, whether he did telehealth for us. So, based on the correspondence, we should be seeing an approval sometime next week, so we can start kicking out all of the Upton Clinic claims, pardon me. Our clean claim ratio went up, which is good. So did our average charge lag went up. It's okay.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
It's okay, I just was looking as a baby.
However, our pre-collect asking for co-payments did go down a little bit. We are currently working on a script for our registration staff, so they will be more comfortable on how to ask their community members for their co-pays. So what we've got is a breakdown of our age trial balance and what our payer mix is. And you can see that we have some rather large numbers in Medicare on the aging part, especially the over 180 days. A large quantity of those, I don't have the exact number, are Dr. Akers. 2 of them are appeals that are just sitting there. We can't, once they hit T status, we can't touch them for 90 days. So they have 90 days to review. So they're going to continue to age until the 90 days is up. Do you have any questions about the accounts receivable? Reports? The statistics, we saw some dips in our hospital admits, hospital patient days. Swing bed was exactly the same for the 3rd month one. I'm not sure how Donalda does that, but we did have her verify that April and May are the same exact numbers. So she did confirm that those numbers are correct. We have hospital discharges. We are required by the state to keep track of our discharges, so they have gone back and included that statistic for us. We can see that we had outpatient observation was down, but ER visits were up, which is good. Clinic days were down from the prior month. Urgent care is up from the prior month, and Upton patient visits is about half of what it was the prior month. The lab has a slight dip.
I asked Mary a question real quick, not to put you on the spot, but is anybody in Upton talking to you about the clinic? Do people just not care if we have it?
Oh, I think they care.
They just
have it. No one comes to me. I haven't.
Okay.
My guess is it's May. Nobody has time to go to the doctor.
May does traditionally have the lower numbers because people are at graduations and weddings and whatever.
The only place you have time to go is the emergency room if you're dying.
Mm-hmm.
At least that's how it is in the ranching community in May. You know,
That's been that way in other rural hospitals. So May and January.
We need to look though, the Newcastle clinic numbers are down every single month since January.
right, yeah, I'm not making excuses for the Newcastle clinic, but especially, I mean, Upton is more rural even than we are, and
yeah, and it's a busy time.
Yeah, you know. So.
It seems like I see a car there more than I did. I mean, I think they're open more
They are.
than they were at one time.
Yeah, we tried to provide,
Thursday,
we tried to provide what everybody felt like that the community was saying that we needed is 4 days, and quite frankly, working through the budgets and stuff like that, I'm not convinced that 4 days makes sense. I think it needs to be maybe longer hours and a couple of days.
Really.
Yeah, because we can't pay for the overhead. That's the challenge. And yet we want the community service, so there's lots of things with the budget process that we've done that we're going to have to continue to work on throughout this year to decide and make recommendations on.
Last May looked like.
What's that?
I said I'd be curious to know what last May looked like because we just go back to July. And just trying to compare to see, is it?
We have,
I don't know how hard it is to add a couple months to this, but
we have them if you're interested.
And we probably have them in our stuff.
oh yeah, if we went, well, yeah, sure, we can probably go back. Maybe.
Just, I've got a couple of questions for you while we're digging through our notebooks. We had discussed, buying from the GPOs in
Yes,
the group purchasing organizations.
yes.
What's the status of that project?
We have reached out to Premier. We had a meeting with them 2 weeks ago, and they're coming in to do what they call a contract and utilization review. At present time, they did mention that we only utilize 34 of our contracts. We have hundreds that are available. So they're going to come in and see how they can save us some money. That is a big project. It's anticipated to be 12 weeks long. So.
And in the meantime, I'm doing a lot of the approvals these days because I've squelched spending without approvals pretty well, but I will tell you that I do call them down there and say, have you ran this through the GPO? Because this looks like something that's a brand name or something. And I want to make sure that you're putting them through the GPO first.
So May 2024 was 67 visits.
In Upton?
Correct, in Upton, and May 2023 in Upton was 94.
So it looks like Upton is kind of sending us a message.
Well, I think that the message that you need to remember is we still have locums and we're trying to phase the locum side out. And so I think that will make some difference. The other thing is we really do need to find a women's health pediatrics focus. So I would suggest to you that it might be that it doesn't feel good because it doesn't feel good to me either, but we maybe we're doing some, I'll talk about that in my report, but we're doing some weekly focuses in that. But I do think that there's a chance that, we need to stabilize with people that are local and staying local.
I think that does affect both clinics for sure.
Yeah, absolutely.
Thank you, Carrie, for looking those numbers up.
Sure. Back to you, Tim.
For the record, Newcastle wasn't that far off.
It was similar.
Newcastle was at the 300 range.
Well, if you add total patient visits plus urgent care, it was about the same number as last year.
Just a lot more people coming to urgent care.
And last August, we had 723 visits in the clinic.
And that's August, not
27.
May.
I know, but I'm just saying, even within the last year, we have 696 visits in October.
Well,
We're down
And then
a lot.
gone down the whole time since
one
then.
thing that you have to consider in August is, or in my opinion, kids are getting their physicals
Yeah.
for sports.
Yeah.
Right. But we still have 696 also in October.
I think right providers in the right. Still things to work on, obviously.
I agree with you.
Yes, it is. So radiology patients were down, and when I asked everybody, I was just told that May is a busy month and we don't have a lot of utilization for procedures. They put that off until after school activities and summer started if they need to. So we have physical therapy is down, occupational therapy is down. However, speech therapy is up. And we did discuss the maintenance option. We did come up with a good way of, not billing our patients for maintenance. We came up with a good cash option that, therapies, Mike was very happy with, and we're gonna be implementing on July 1st. So, we won't have any further billing issues with the, therapy maintenance patients.
Is that the $10 a month?
Yeah, $10 a visit.
And
Yeah.
so the lady that was upset about that, did she get told that it's back to 10?
I don't know who it was that got upset about it.
Yeah, I was just told that it was an issue that was being discussed.
I bet that was
So it
prior
isn't
to
a-
you.
It isn't an issue with the price, it's an issue with the
having
billing.
to
The billing.
bill.
Yeah,
Yes,
which,
I know.
yeah, that's
So
what
I'll
we
look
talked
at
about in
in the
finance
email.
that Tish is
Because
gonna.
I know who
Yeah.
it is and I can make sure that they.
So supposedly,
That way
the
you
part
can
of the
see.
process is Mike is going to notify them, and they are gonna get a notification when they come in. They're gonna get a flyer that Mike designed. So this is our process going forward. So, and we got a list of all the patients, so we could make sure that they're all aware.
Community members, they're not patients, they're on maintenance.
Well, community members, yes, it's like going to the gym. But, so we were able to resolve that fairly easily, on Wednesday. So that worked out very nice. I forgot where, occupational therapy doesn't seem to do a whole lot. I don't know if that's just something in our community that it's not a bigger need. It's required for swing med, but, and then of course the Manor, Shane gave his report. We are up, which is always very nice. And then we have dietary meals served. You can see that that is continuing to go up, which is great. For a while there, we weren't serving staff at all. And so now we're serving patients, staff, and residents. With the increase in the census in the Manor, laundry has gone up, and Kathy did stop by and visit with them the other day, and they seem to be happy. They're still happy. So, and then we have retail pharmacy scripts, which is down slightly from the prior month, and hospital pharmacy scripts follow suit with the rest of the census. And then we have the nursing home scripts were up because we have a higher census. And then we have our AP checklist. Carrie and Nathan had made mention that this was something that they used to get. So we've included it again. I wasn't sure of the format, so I put all the checks in alphabetical order, so it would be easier if you guys wanted to look up a particular vendor. If that doesn't work for you, please let me know. So you can go through, and everybody with a little asterisk in front of it is a staff member. And the reason you see so many of them is we're paying mileage through AP. We had a slight little glitch when it went through payroll. If you had elected to have additional taxes taken out of your check, the payroll system didn't notice whether it was a reimbursement check or a payroll check. Taxes got taken out of it. And so it upset staff, rightly so. So we just decided we would move it over to the AP where there was no chance of any taxes being taken out of their reimbursement. So you can look in here, and it's like, for example, under B's, it shows Blue Cross Blue Shield of Wyoming. Those are our two bills for our health insurance for the month. We're not in arrears, so that is accurate. So if you have any questions regarding any of the bills we've paid or the vendors that we have, please be sure to reach out.
I know attempts are being made to ask Blue Cross Blue Shield to more or less prove to us what they're asking us to pay. How are those efforts yielding positive results?
I still find them very frustrating. So I know the broker's been working very closely with us. Every month or every bill I get an accounting of how they've applied our payments, our historical payments. What I'm finding is if they have a small outlier, so they've never posted the checks to the matching invoice. So they're breaking up our payments. So what it's doing is on their books, creating a past due, when on our books, it shows we've paid the entire invoice. So that's the frustration that I have with it.
This place is full of love. You can tell the people that like to be with old people because they really take care of you good and are very kind.
Twice a day, every day, activities people have an organized activity that's always interesting.
Everybody loves to play bingo. We play it 3 times a week here. We also have ceramics that you can paint. Really pleasant to live here. It's a good place to be.
So it seems like a flawed process that could easily result in us accidentally overpaying them.
That's why we reconcile it with it every month now, because we did have where we had on the books.
And I mean, their process.
Yeah, their process is not good. It's not a good process for us. So we do ask for a monthly accounting for historical purposes, so we can see that they're at least posting all of our payment to our account.
So I have a random question.
I may have a random answer.
What is Tropical Creations?
Oh, it sounds.
Yeah.
Oh, that's the, okay. I was like, that just sounds, yeah, that makes
Does it
sense.
sound like fun?
Yeah, it does. I'm like, where's our tropical oasis? There we go. It's the fish.
So,
Okay,
in
good to
case
know.
anybody's wondering, so the check register adds up to a little over $1 million of checks. But if you'll notice on the cash report, the non-payroll is $436,000. So I kind of dug into that, and the Blue Cross Blue Shield is running through the payroll system, and there's 3 staffing agencies that also run through the payroll system.
Yes.
And so when I took those out, I got to within less than $1,000 of that number. So when you see that $1 million, if you wonder why it's not reflected on our cash report, that's why.
Yeah. Thank you for explaining that. That was very nice.
Because that was a shocking number to me.
It's a shocking number to us too, every time we have to look at it. So thank you for explaining that.
One of the vendors kicked off, used to be a resident here. I see, he used to write software. When I was at the county, he did a lot of the county software.
Is it the $2,000 check? It's rent for his house.
Okay, very good. I thought maybe we were still using his software.
No, he's a landlord now.
That's fine.
Not the best one, but he is.
You answered my question very, very easy.
So I have a question. What did we pay the Newcastle Lodging Convention Center for?
We had a locums that they made the recommendation that we put her up in a place that was to her standards, I guess is the way that they put it. And she decided that she was very comfortable there with a suite with a kitchen in it. And so what happened is the bill came to us, they discounted their bill. So it's kind of convoluted, but we actually are not out any money. It just shows us paying the check.
We paid the
We wrote the check, but we didn't have,
Was this a locum position? or?
It was a locum, wasn't it a nurse practitioner?
I thought she was an
It was a nurse practitioner, and we actually had to fight with them a bit because we had to show them that their contract did not, that they had to pay for the room. So that's what we did and settled the account.
I was like, whoop.
Right, because that 24,000 did not work out to be in the invoice line.
And they didn't like us pointing out their error in their contract. So.
Oh, man.
Thank you for doing
That was a good catch though, for almost $25,000.
Poor Denise.
I had it in writing, so I was able to.
Oh, good for you, Denise.
Good job.
And newsletter journal is advertising?
Yes, for
Oh, yeah.
marketing.
Advertising.
I think jobs and,
I thought
clinic
Randy,
blips.
I thought Randy said he canceled that.
And, I'm sorry, Randy.
So I guess,
Didn't we
I don't
after?
know. I thought we were going to renew it, we didn't, but we're still doing it.
Yes.
Because we've been advertising in the newsletter
We
journal
didn't
and this is
choose
paying
to
it, right?
do the.
Yes.
There was
Yeah,
like
we have a
plan or
weekly
something
ad.
that we
That's
chose
week
not
marketing. It's our marketing.
So, Tish, if I could ask you a question. So I was looking through some of the retail pharmacy bank statements.
Yeah.
And what I'm noticing is the difference between what they're spending and what they're collecting is really slight. It's a very slight difference month to month.
So can I?
Can I?
Yeah, when you're done with that, I may have an explanation. It may not be a good explanation, but I can at least tell you what happened.
Oh, okay, because I would think, there should be a pretty decent difference between what they're paying out and what they're collecting, month to month.
Yeah.
We should have tiered pricing, but I don't think we do right now.
So we've got a couple of different things to do. So when we started digging into the fact that the pharmacy revenue wasn't being reported because it's a manual process, we were also looked at the cash posting and where things are going. And what we noticed is when we look at the bank statement, you can't tell the detail. And so what we ended up doing is not all that hits the retail pharmacy account is for the retail pharmacy. Some of it is for the hospital pharmacy. So we're now trying to get the vendors to do the hospital out of the receipts and operating account. And the pharmacy only pays for the pharmacy stuff out of there. So it's taking a little longer. They anticipated it would take a couple of months. It's taken a little bit longer than that, but I'm hoping to get that straightened out. We will get that straightened out.
I have one more I'd like to, what's the division of healthcare financing?
The Division of Healthcare Financing is Medicaid.
Okay.
I actually know the answers. It's so exciting.
We get regular mail from them. That might be part of the reason.
Yeah, I see a lot of mail from them.
It is informational to see this. What's that?
How much longer do we pay Piper?
This was this month.
Oh.
This month is the end.
This was the last one.
We had tried to set it up so that it wouldn't carry over to the next fiscal year. As I remember. So.
Yep. She picked up her last check.
Her mom did.
Her mom did.
Yeah.
It's good information, isn't it?
It is actually.
Yeah. Well, good. I'm glad it was useful.
Okay, are we good?
Unless
Do you
every,
have anything more?
no ma'am.
Sorry. Okay. So I wonder if we should take a 5-minute break.
Yeah, that's fine.
Great.
Oh, look at that, I thought of it before you did, Ted.
Well, I've been thinking cake. I need to get a piece of cake. I need to get a piece of cake.
You're back in my. I don't think we've had, I believe this is a watershed moment. I think this is the very first meeting we've had without executive session since I have been on the board. At least.
Nope.
We need to thank Allison, honestly, because I was ready to put one on, and she's like, no. She didn't quite say no, quite like that. She's like, I don't think you really need it, Ann. It's really nice.
It is.
We get a fly in the hospital.
Hope there's some left when I get done.
Oh, there will be. That's quite a bowl there.
Yeah, there is a bowl.
Yeah,
And the
there's not
watermelon
enough
is very
nurses in the
sweet.
nighttime
I
to
think it was,
eat it
you
in
know,
lab.
Okay.
And if you go
Not
to
quite
the
right,
Grab Mercado
but it's very
It
sweet.
does look,
counter,
Light,
they go like
yeah.
this, all the flies leave.
You
And
get
it's like, I
close to
can't.
the edge and I think
Not
probably.
down.
puts the-
I eat lots of veggies.
The middle is.
I like
fish.
it. I don't like it when it's mushy.
I haven't gone through what.
Yeah, just,
The watermelon.
no, I have very sweet
Mexico
stomach.
for me.
Mhm.
And it creates
The rest of them leave.
any month where we spend 2 million.
Exciting.
I had a
Right,
candy
I did the
Mary Schroeder
years
though,
ago.
usually will stay on if she,
So
but she's
you
probably
did.
doing something else.
She was from Florida.
To make sure it's those.
Walter and Mary.
She would take it out, hang it in the
Yeah, but Mary
tree,
lives in Gillette
5 months.
and
either a day or
Walter
two.
lives here.
She knew when to bring it out of the
Right.
tree.
So
It was
faces
wonderful
to-
watermelon
Yeah.
every time. I have thumped watermelons, I've done everything.
Mary's not going anywhere. She's been here except on video.
Not ripen.
So,
I'm talking
And
about.
we did all
Encouraged to come in person.
I don't think so from their boss. Well, not Mary so much, like, probably because he'd have to be here.
How that happened.
But
So they have in the past come in.
So that's
and
where
then-
we were at 6:30
and Walter's thing just died today, so.
of this year.
And then
Here, but we.
there was one that she started when they had
So if you do, we had
options on Zoom, she started doing that because it was easier for childcare.
Yeah, I love Zoom options. I mean, sometimes it's hard to read people on Zoom. Yeah.
That cake is delicious. The pie's even better.
I was gonna tell you guys later, but it's Denise's birthday, so you can.
Happy birthday.
So I asked for cake since I had to work.
Oh, happy birthday, Denise.
Thank you. I said if I'm gonna have to work, we need to have fun and have cake.
Right, exactly.
No wonder you want a chocolate cake.
Is chocolate your favorite,
The
Denise?
whole cake.
Is chocolate your favorite cake?
No, white cake is, but I love chocolate, so.
Admit.
It was really nice of you to share your 29th birthday with us. My 29th birthday.
I was just trying to figure out how much younger you are than me.
Okay, so, are we ready to get back into order? Okay. So we need to, we're gonna move into our budget discussion. I had a few things that I wanted to say. So and correct me if I'm wrong, Kathy, but, Kathy and Tish basically worked on the budget in May, getting it ready for us.
Yeah.
And, what's that?
Shane also helped.
And Shane, okay. And then we asked them to take it back and look over it because it had too many expenses and too much revenue. And so we asked them to make those changes. From what I understand, the three of them worked up 3 different budgets during this past to try to find one that would work. I suggested to Kathy that she present to the finance committee a budget that she felt like was the most helpful for the hospital, that would work the best for the hospital. And so, at the finance committee. And then on Tuesday morning, Nathan called and said that he had a budget proposal or some ideas. And so I asked him to present that to the finance committee as well. So I do think that one of the things that we need to remember is that the budget is a tool for Kathy and her team to help the hospital run more efficiently and to make good business decisions in the process.
Can I ask a question? Is there a deadline that we have to make a decision on?
We have to
And
have
who
it.
imposes that deadline?
The state imposes.
So it's a state law that's requiring us to pass a budget. It's not just a tool. This is a
Oh, yes,
legal
correct.
requirement.
Yeah.
This is
Yeah.
not just a tool. This is us giving permission to spend.
So the budget's not perfect, the numbers aren't perfect. They are considerably better than they were last year at this time. And so how we're gonna do this is Kathy is gonna talk to us about the budget and give her pros and cons on her budget. After that, I'm gonna give Nathan the opportunity to do the same. And then we're gonna work around the room and each of us are gonna tell what we think. And then when we get to the end, I'll give Nathan the opportunity to kind of recap his stuff. And I'll give Kathy the opportunity to recap her stuff.
I think I need to get this.
You need
That's
more.
all right. I think I have enough of them, so.
I brought some extras, but not sure why I printed them.
Did you print the copy that I had given you earlier, this one?
Yes.
Okay, so
Is it just the info sheet? We don't have an actual thing with numbers?
I think it'll be understandable once I read it, so
Okay.
you'll just give me that.
Is this what we have?
Yes.
Only one sheet.
Only one sheet.
Okay, we're all like, what?
Okay, well,
There was a bunch
let me,
of stuff
let
going
me,
around, I didn't know.
let me explain, okay? So, I assume that I can talk and you can look at the points, but I'd rather you listen to what I'm saying, okay? So, we really have worked very hard on the budgets and I want to make sure that everybody knows that. We work in a system that's, lacking some stuff. We don't have our 2024 audit yet. I'm going to read off of this because that'll help me. There's some things about it that's not reliable. We've all agreed with that. We did go and spend a lot of time looking at line by line costs and expenses and those kinds of things. So we really spent a lot of our time on that. Since we had the feedback with Nathan at the last board meeting and Ben and the kind of discussions we had, Ted, I think, I gave you my promise that I would go back and rework the budget, which we did do, and we worked on it quite a lot. The other thing that I did do, based off of talking with Nathan on a couple of other occasions independently, is I asked John Gantner to come look at some of our stuff as well, to be able to give us some of his perspectives on it. I'm sharing some notes from our talking points that we had as a team working on this, but I'm not going to be sharing any dollars or amounts because we are working on that as we speak at this time. So as I mentioned, over the past several months, there's been substantial discussion both within and outside of the boardroom related to the creation of fiscal year's budget. At their core, the major issues affecting the formation of a fiscal year budget relate back to breakdowns in financial systems and controls dating back as far as 2022. Those fiscal challenges were exacerbated by poorly executed conversions of both payroll system and the general ledger system. In retrospect, those conversions could not have occurred at a worse time for the organization. Although financial systems and controls are steadily improving, they are not where they need to be to assure that WCHS can routinely produce the financial information required to guide operations and strategy. Although we do our very best ever since I walked through the door, I will tell you that. We didn't even have, I had to ask somebody to open up a screen and show me what cash we had on accounts because I didn't have any access to that for the first bit of time I was here. Fiscal challenges notwithstanding, WCHS is mandated to produce an operating budget by mid-July to meet statutory filing requirements. WCHS also has a moral obligation to provide the community with responsible and transparent accounting of the WCHS's operating plan for fiscal year 2026. Both the board and WCHS administration take both of those responsibilities very seriously. On a call earlier this afternoon, and actually I've been on a lot of calls in the last couple of days, we did talk with, I talked with Nathan and I talked with John Gantner, and then Tish and I've talked with John Gantner a couple of times yesterday and today. And we talked about administration and board's representation, discussed this somewhat unique approach to, where am I at? Sorry, guys. On a call earlier this afternoon, administration and board representative, which was Nathan, discussed a somewhat unique approach to formation of the fiscal year budget. Briefly, the approach will be grounded in actual cash receipts and disbursements over the past 12 months as adjusted for known and planned capital expenditures and anticipated changes in program services activity levels. The budget will also include a review of Medicare, Medicaid, and IGT, which is our that's our payments we get from Medicaid that's adjusted.
Thank you.
And then the budget will be compared to bond covenants, required action plans, and will be developed as required. So essentially what I'm saying, and I'm sure Nathan can add to that, is that we're going to try to come up with a model that uses the cash positions that we have. We do have some preliminary data that we got that Nathan doesn't even know about with the 2014 budget. I mean, the 2024 budget. It does show right now a positive margin, although it's very infancy and it may not be a positive margin. It's like everybody's worried that it will be, but at this point it is a $1.4 million swing to the positive. I'm not going to present the budget. I will tell you, I respect the work of the team, and I respect the work that we've done through this whole year with our whole team, our department managers and leaders, and with the executive team. We have worked under very unusual circumstances, and we have had a very tough time trying to run an organization with day-to-day changes to everything that we do. So what we're proposing is that we do not go to a final budget until we've had time to work additional time with John Gantner, with his expertise as one of our subject matter experts along with us, so that we can come up with a reasonable decision relative to the budget. So that is my report.
I just want to say I actually think that's a really awesome way of thinking out of the box to manage a situation. It's also, I mean, I feel definitely the board feels it also that it's difficult for us to make decisions without a good financial picture too. But this is, I think that sounds like it's some out of the box thinking to try to make something work that would be.
Well, you can give that credit to Nathan, and then when we're talking with Jonathan, I'm not going to take credit for that, but I will tell you, I respect the work of this team that did the work on our budget, and I got to tell you that they did the best they could with what they had available to them.
Madam Chair, are we going to have questions later, or can I ask a question now?
Questions later, please.
Okay.
So I'd like to start and say I think Kathy is doing a wonderful job. I think from everything I can see that we're really moving in the right direction. In the last couple of months, I'm seeing the bank account grow. And what I want is for us to just keep doing what we're doing. I think we're no longer broken, and I don't want change. I think Kathy's kind of got things dialed in, and I'm very happy with the direction that we're going. So thank you for all your work. I just wanted to, I prepared a handout. I only have 10 copies. So
why don't we make copies for you?
I'll get as many as I can.
Just make pen anyway.
More, so.
Okay.
Didn't know how many
Thank you.
people are here.
They're making some copies from here
There's a
temporarily.
couple more.
Oh, okay.
Right, you probably have close to it.
Thank you.
This fly.
Look at me too.
I hate a fly in the hospital. I hate it.
Did you see this? Thank you.
Does everybody have a copy or are we still waiting?
I don't know, I think you can talk about it. Here, Shane can have mine, I don't care.
So,
Shane's gonna have 5 copies.
so there's 2 different sets of data that we've seen. We see the accounting system data, which has been used to build the budget. And then we see the cash flow report each month in our board. And so this is a comparison and to show that the 2 different systems are telling very different stories about what's happened. So the accounting system so far says we've had 29.3 million of expenses, but our cash report says we've had $22.6 million of expenses. It's a big difference. So by the end of the year, total expenses for the accounting system should be 31.9 million. But the cash report says it's gonna be 24.7. The budget request is here. It's the same in both instances. And so if we believe what the accounting system is saying, then the preliminary budget request for next year is an actual $4 million reduction in spending. But if we believe what the cash report says, then it's a $3.3 million increase in spending. So these amounts are so far apart. And that's what's driving the request to say, okay, can we look at something that is likely to be reliable? And I'm glad that we did agree that it is an unusual situation. But I believe if we go back and look at what's actually happened in our bank account in the last 12 months and let Kathy make appropriate adjustments, I think that's the most rational basis that we can make a decision on at this point. And so I'm very glad that we've come to this place, and I do agree, it is an unusual request, but this is why I made the request. These amounts are off by so much that it's, as a facility, we've never spent $32 million in a year. So fiscal year 2023, our total expenses were 27 million. So I just think if we really spent $32 million this year, we would be totally broke. I mean, we can't afford that level of spending. So I have a really hard time believing that we actually spent $32 million and we still have about $6 million in our checking account. But I also agree that the 24.7 might be a little bit on the light side. And so that's, I think, the best I can do to explain the core concern.
When you say, where did you get your numbers from, the accounting system?
From the May accounting report.
From?
Well, it wasn't given to us in finance committee.
From this one?
No.
No.
So in April, we were given.
Are you talking about this one? Yep. So when we were given this in finance committee, Ted, refresh me if I'm wrong, or I thought we were given this because you said this was for us to look at for formatting and the numbers aren't right yet.
It was,
Because I wrote formatting.
it was for the formatting, to make sure that the formatting was what you wanted. The department managers would like to see the general ledger numbers on those, so, that they made that formatting request, but that was what it was primarily for, because I knew we didn't have all of the revenue booked. We still have hospital pharmacy revenue to go back and book for the last 11 months. That hasn't been done, but
is that?
I knew the numbers
part of
were
the
correct.
reason
In the
why
April-
they
no,
might be so off?
No. In the April report, which you have in front of you, it says fiscal year to date profit of 2.5 million. Tish told us in our last board meeting, we had made $2.5 million for the year to date. And I told the board that couldn't be possible. So you can't have it both ways. You can't come in the board meeting and tell us we made $2.5 million and then say, oh, no, I didn't give you the report for you to rely on. And the budget that I have seen is based on data from the accounting system.
Madam Chair, I would ask for an executive session, please.
Okay. Allison, can you help us formulate what we need to say for the executive session?
Sure. So topics for executive session and could include legal advice. It could include employment matters, and I can pull up the statute. Do we have a topic?
Personnel and legal advice.
Okay.
It won't take long.
Okay.
Sorry, I jinxed us.
That's okay.
So that's sufficient information. I can update the minutes with the statute references, but that's enough information for the board to move to go into executive session for those reasons.
Thank you.
Are you
We need
planning to go
somebody
into
to-
exec right now then?
Yes.
Or
Yes.
Yes, we need somebody to move to, we go into executive
Need
session.
a board member.
I make a motion that we go into executive session
For
for
personnel.
personnel and legal advice.
Do we have a second?
That
All those in
statute should
favor?
be written,
Am I
also read.
Okay.
Yes, you can do that.
she said she'll update with those because we don't know
Okay.
right now.
All those in favor say aye.
Aye.
All those opposed, say nay. It won't last long. So,
We got the one.
It's okay. You know what I mean, unless you want to come back in.
You're my boss.
I say you said your piece, so that's good. Thanks.
thank you, Tish.
Thank you. Have a good night.
There's a whole lot of people in jails and prisons in Wyoming who really didn't mean to do anything wrong, but they screwed up and they did. But apparently Becky Hadlock and other elected officials in Wyoming are in fact above the law. At least that's what I think the governor showed us with his decision.
And I think he did too. And I think he makes it blatant by avoiding the clear violation of the law. The rest of it, you can, yeah, she got the testing done. It was at the last minute, at the last chance, and she failed it. But she did submit the report on the day, even though it was like 11:59 or whatever. You know, like there's some ways you could finagle the other things. But he blatantly ignores the malicious intent and the felony committed.
And he jumps through so many hoops to let her off.
Madam Chairman, can I go ahead and read in to the minutes what the reasons are under the statute before you get going?
Yes, please do.
Under Wyoming statute, the board moved into executive session under 16.4.405A2 to consider the appointment, employment, right to practice, or dismissal of a public officer, professional person, or employee, and under IX to consider or receive any information classified as confidential by law, including legal advice. Thank you.
Thank you, Allison. Okay, so Nathan, how much more? What, do you want to keep going?
I can conclude by saying thank you to Kathy and her team for being flexible. I'm very pleased with the proposed course of action, and I look forward to seeing the results at a future point.
Am I safe to assume that, so we're going to be having a specific meeting
Yeah,
for
we're having,
budget here in a week or two? Okay,
in a public hearing.
sure.
So,
Okay.
how do we want to do, I would like to hear what people are thinking about as far as this budget goes. Do you want to start, Carrie, or should I start with Doreen, or? Go ahead, Doreen.
What exactly do you want comment on, Ann?
I want to know where you are standing as far as what your thoughts are on the budget and the process you've gone through and where you think we need to go. And
Well, to me, it sounds like we're definitely still in the process and maybe at a point where we're slightly changing is what it sounds like. I think it sounds like a reasonable way. I think it sounds like a great idea to go forward with what Kathy said. And then we'll have to actually look at budget numbers when we have a proposal.
Ben, where are you at?
Well, I'd like to say, first of all, I appreciate Kathy's efforts, and I appreciate where she's going with this and her flexibility. It is a very unique circumstance. I have never come across what she's been dealing with, and that's not easy for any leader to deal with. My frustrations come down to the numbers we're seeing in the financials and the ongoing problems with financials not being accurate and trying to base a budget from that. So I think the plan forward is good, probably the best we're going to do related because of this issue. I would just publicly like to make sure that we're continue to focus going forward best we can on what's going to be the fix for accurate financials in the future, however that plays out. And I trust you to do that with your team. So
I'm committed to it. Thank you.
thank you.
So I guess my question is, will this stuff be taken back to the finance committee? Now?
We don't have time to take it back to finance.
Yeah, that's up to you guys, as a finance committee, if you want to see it first.
It won't be. So is there any kind of compromise between what Nathan presented and what you have? Is that what you're?
We're in alignment. It was the approach of how do we best figure out. So I like what Kathy's doing, and I want her to just keep doing it. I think she's doing a great job. And so if you ask me for a budget request of X amount, I just want to know, how does that compare to what we've been doing? Is it like 10% more or 50% more? And that's really all I want to know.
Well, I'm going to use John Gantner as a reference point. He's willing to help me with it. He hasn't wanted to charge me for any of it. I don't know if that'll stay that way, but truthfully, I think between him and I and our team, we can try to figure out something before we have our deadline hit. So I can't give you the days. This is me just humbly trying to say, I'm just trying to get you numbers that everybody can be settled with, and that we speak to the community in a way that we need to, and that, we work with the barriers we have, which we have significant barriers, even though we've been working for a year. We didn't get here overnight. And I'll just remind everybody that we said it was going to take 1 to 3 years, maybe 5, to get ourselves where we really need to be. So this is John Gantner and I've worked together in more places than one, actually. And so, I trust his expertise to be able to take us, to take in that advice, to be able to develop the budget so that, hopefully we get a result that's comfortable for everyone.
Well, I probably can't add anything that hasn't already been said. I'm in turmoil, just like you all, and I know you all have the same feelings I do, that we all want a hospital and a better hospital next year. We all know that. I'm not telling you guys anything. I believe you know, but feel the same way I do. And it's tough to come up with a number when we don't have old numbers to work with. And we all see that. We have all agreed to that it's going to be, like Kathy just said, 1 to 5 years. Hopefully we'll have some numbers in the future for future boards to work with. I really can't. All we gotta do is move ahead.
Can I just say one more thing? I know it's a really stressful time, but it's a lot more stable than it was 1 year ago at this meeting. It's a lot more stable. If we can hang there stable till other things all start to get fixed, you're doing an amazing job. You got us from a place where we didn't even know what our next move would be. So, well, I know it's super stressful, but really grateful for what you've been doing.
Thank you.
So last year, we didn't have accurate financial information either. And the finance committee, we didn't have Kathy either. So the finance committee took it upon themselves to start the budget discussions, and we developed a framework by meeting with all of the department heads, talking about their needs and their wants, and just as Kathy did this year. Kathy came in, the finance committee didn't do that, but Kathy built this budget with the input of all her team. She met with every single department. She talked about what their department could look like, and she developed a budget that gave every team goals for growth, which the hospital as a whole needs. We can't put a baseline budget with everything the same, because then no one's motivated to grow. She put together a budget that put some of our needs, definitely our needs, but some of our wants, like to fix the clinic, to grow radiology. She put that into the numbers that she came up with here. And it wasn't just her, it was the whole entire team in every department that helped her to build these numbers. And all of us, everyone has said, we support Kathy and we support your team and you're doing a great job. But the amount of time and energy that her and her entire team have put into putting a plan forward to this board just to have it blown to smithereens is, I want to say heartbreaking, but it's really demoralizing too. And I feel like if we do just blow everything her and her team developed up, we're doing her a huge disservice. And while we say we all support her and we trust her to move forward, we're not showing that in these actions, because we've now taken her off the line and inhibited all progress in this building for the past month, and now you're going to tell her to do it for 2 more weeks. but we haven't given her any real clear direction other than we don't like this. And that isn't fair to her and her team. And that's the way I feel.
I'd like to respond. This isn't an issue of whether I trust Kathy. This is an issue of whether I trust the data in our accounting system. So if I button my shirt and I get the top button wrong, every other button's wrong. No matter how hard I work, they're all wrong if I get the first one wrong. I suspect that the data in our accounting system is still horribly flawed, and any work built on that source data is going to reach a very
I
dangerous
understand
conclusion.
that.
Okay,
But
just
Kathy
clear
and
that up.
her team, a budget is fluid. A budget is a plan, a budget is a guess. A budget is also fluid. What you're asking for, based on cash flow and her team adjusting every single month based on the cash flow in and out, that's what she's doing now, and you're happy with that. So let her continue with that. A budget is just a framework. I disagree with what you said when you said it was a license to spend. Kathy is evaluated on both the top line and the bottom line of the budget every single month. And if we tell her your budget is whatever, we give her license to adjust spending based on revenue, and she's going to do that every single month. If we throw her whole budget out, we throw out every assumption and plan and plan for growth for this year that she's built with her team.
May I respond? I fundamentally disagree about what a budget is. In my mind, a budget is solid and it's to be stuck to, and it is a guardrail, and it's set based on the best data and information that you possibly could obtain. And then you do the best you can to keep your expenses below what is the guardrail, and you pray that your revenue is higher than what you've guessed it to be, or assumed it to be, or judged it to be. So my view of budgeting is totally different than yours. I don't see it as a wish list, a want list, a desire, a goal to shoot for. It's something that is written in stone that must be followed. And so maybe that's a problem right here, is we have a fundamental difference as a board of what a budget should be.
So Ben, what I was saying, I understand what you're saying, but when you're in private industry, right, if you have a budget and you budget that you're gonna make $1 million in revenue, and 3 months in, you're not even close to that $1 million, you're gonna start adjusting your spending, right?
I would hope so,
So
yeah.
that's a fluid
But
budget.
it doesn't change your budget.
Right, but it's a fluid budget because you look at your revenue and you're like, well, I'm not at revenue, so I'm gonna adjust my spending down. And that's what I mean about Kathy. That's what Kathy's doing now.
Right, and I think I can agree with you there, but that's, in my mind, different than the budget itself, which is written in stone. It's a document that's forwarded. It's something we're saying that this board agrees to. It's something that we're saying to the public that we say she can have this amount, and we're planning on this amount of revenue. If there's adjustments that have to be made related to expenses because the revenues don't come in, then that's an operational decision that's made by Kathy as she goes through it. But the budget never changes. So it's not a fluid, in my mind, the budget isn't fluid, but the operational decisions are.
And to add to that, if I'm understanding and remembering correctly, one of Kathy's desires for her to be happy in this role is that we don't micromanage the finances throughout the year. And so my interest in getting the budget right at the beginning of the year is so I can live up to that promise and say, Kathy, this looks like a good budget. As long as you're within budget, I'm not going to say one word to you this whole year about the finances. That was her goal for what she wanted to be happy in this role, and I'm trying my best to give her what she's asked us to give her. And so the budget is not fluid, and the law requires that we pass the budget. It is a legal requirement. It is permission to spend. That's why we're being asked to approve it.
Okay, so I asked you on Tuesday too, and you didn't have an answer, but I know you like to think about things. So what is the number where you want?
I want it to be a data-driven decision.
Right, but.
So I said, I'm happy with what we're doing now. All I want to know is, what are we doing right now? And let's keep doing it. That's all I wanted to do.
Right, but where's your bottom line? Where?
You're not, okay, let me try to say that again.
But you're not,
I
we're not
like-
giving her any direction on where we want her to go.
I like what we're doing right now. I want to just keep doing what we're doing, but I don't know what that is.
We gave direction last month. We gave some numbers last month that we thought.
Okay, tell me what they were, cause I don't have them.
Okay.
Ben, where do you want to be?
If I'll ballpark a number for you. If I would, without a lot of data, okay, I would say, somewhere in that range of.
For what? What are you, which
Yeah,
line are you
You're asking
asking
for an
for?
overall
revenue and
budget number,
expense.
expense number. I would say in the 26 range.
Okay, and
Again, don't hold me to that. I'm just,
for expenses, and where do you want to see revenue?
the revenue to me, that one has to be, I couldn't give you a number off the top of my head.
Okay.
I'm
just wondering, I'm just
Yeah.
trying to narrow us down to
I don't
how
know.
far.
To me, we have to base that off of what would be a reasonable average of what we see coming in, and then add maybe in the idea of growth and moving forward and improvement, add some percentage points to that, a couple, a few, and shoot for that.
My notes say that Nathan recommended last month 26.
Okay, see, I didn't remember that, honestly.
I wrote that on my notes because that's what I keep. Yeah, that's what I have on that.
But again, that's, yeah.
So I'm not hung up on a number. I just think that we're finally, after a year of struggling, Kathy's finally made enough progress that we're moving in a good direction. I just want to keep moving in that direction. And so when you say, here's the budget we'd like to have, I say, how does that compare to what we're doing now? Is it like 10% bigger or what? I think that's a question that should be able to be answered. And that's my goal, is let's just keep doing what we're doing. I think we're going in the right direction. And just tell me what it is that we're doing. And the only way you can find that out without an accounting system that's working well is to look at what's happened in the banking. We're on a good trajectory. Let's not change. Let's keep doing the same.
At least until we get accurate financials.
Yeah.
But we have to give her a direction to work towards, otherwise she's gonna spend
So-
the next 2 weeks giving us something that you don't like
So
again. So we
as
have to
long-
tell her where.
So Kathy has agreed to a plan. John Gantner's agreed to help. The plan needs to play out, because what we need to do is say, what is it that we are doing?
Okay.
It's working, and let's
Okay.
just keep doing it.
But what happens if the plan comes back and it looks just like this?
I'm not the only reason I have to object to the numbers is because in April, our accounting system said we made $2.5 million. And by the next month, it said we've lost $2.3 million. Our auditors told us the accounting system is not reliable, it has material weaknesses, therefore it's irresponsible and reckless to trust it until it gets audited. And my objection is nobody should be building a budget based on that dangerous of a flawed set of data that's moving around that much. So let's not use that. Let's use the only other thing we have, and that's our bank account. That tells us the story of what we're doing now. Let's look at what's happening there, make some reasonable adjustments, and keep doing what we're doing and move forward with that.
So if I can interrupt, Kathy, would you be willing to explain to us the normal process of doing a budget for the hospital? What you've encountered in every other hospital that you've been at? Can you just tell me, just explain to us the normal process?
The normal process is that we provide projected volumes and statistics like that we're looking at, and then you build your revenue off of your statistics from the volume. You spend time with all of your departments. You look and evaluate where you were strong, where you weren't as strong in the previous year, and where you had some overages. You look for things that are going to be a one-off, things that were one-off that you can reduce from the budget considerations, and anything that you think might come up in the upcoming year. You try to have a good understanding of what your contracts are, and you have to make some guesses as to how much things are going to increase from pricing. So whether it's water and utilities and contracts and all of those things. In fact, we even had to think about tariffs increasing supplies 5% in our budget for our supply systems and that. So you basically just go through every part of your business model and every part of your departments and talk to them about their business and what you would like, what we would as a team like to see happen, and encourage growth where we need to have growth, improvements where we need to have improvements. You take the numbers that you have available to you to be able to write the report. We know we took out $2 million in this last one, for example, on stuff that we knew that we could take out of that budget and have the goal to make sure that we can meet those because of the things that we have been able to change in the model that we have relative to putting money where it's supposed to belong and having it, because we've had money that didn't get accounted for. We've had money that didn't belong where it was at, and we've had all of that to do. So that's not normal. Normally you have systems that work like they're supposed to, and you just are projecting off of 3 to 5 years worth of data depending on your companies.
Right, and so John told me that we don't have the statistics or the volume data, so we don't have the core set of data to even start the process with. So
we have statistics for a year.
Right.
Yeah.
Basically, since you've been. Yeah.
So what about the board's role? What's the normal thing that a board would do?
And usually there's a conversation about any concerns that they might have and that sort of thing, but I've not experienced having to go back to the drawing board again and try to put budgets together again. Of course, I've not experienced the lifestyle that I've had here in any other place. And usually you talk about that and you talk about why we think that we can get to that kind of measure and what we've done to be able to do that. I did write some assumptions that I was working on. So you usually give assumptions to why you make those numbers the way that they are. And we did do that. But I recognize that the numbers are not fully reliable, but they're the best ones I've had since I've been here.
And they're the best ones we've had since I've been here.
I'm sorry. I'm tired, so time to go home.
Okay.
Did I explain it enough?
You did explain what I want to hear. I haven't said what I think, but I am extremely frustrated. I am frustrated that we've spent 2 months at least, and that we're asking for another 2 months to work on this budget when we have a hospital that needs to be run and we need to be working on running the hospital. And we're taking Kathy and Tish's and Shane's and everybody else's focus off of running the hospital to find a perfect number that we might not ever find because we don't have the numbers to back it up. And when we run our ranch, we have a budget, and that budget, we use it to make good decisions the best we can, but we cannot, we always and I have 30 years of data, and every year there's something different. And so to expect us to have an absolutely, positively perfect budget, I think is nuts.
I'm not asking for perfection. I'm happy making decisions that aren't perfect, but in fiscal year 23, this hospital spent $27 million and lost $2.3 million. The initial proposed budget is much more spending than that. If we have a soft revenue year, it could be our last year in business. That is what I'm fighting for, to avoid signing off as a rubber stamp trustee who sees major significant errors in the accounting system, and that being used to build a budget while we don't have the typical statistical data and the volume data. I see a very dangerous situation such that if we have a softer revenue year and record level spending that we've never ever had before, we could be shut down in a year. I can't in good conscience just throw my hands in the air and say, all right, that I'm not doing my job at that point. I know enough to see the danger. I do not want this hospital to shut down.
I don't think any of us do.
Okay, so what I'm asking is very reasonable. I like what we're doing. We're going in the right direction. I want to keep going in the direction Kathy's got us on. Please just tell me, what have we been spending so I can understand how your budget request relates to that? That's all I want to know, and I think that's a thoroughly reasonable request.
And Ann, I appreciate what you're saying, I do, but, at what point do we say that, I guess my question would be, how many years has this hospital done exactly what you just said? Where it's just a number that just comes up with, that is determined that.
All I know is that
So-
this year's budget, the work that went into this budget is it is considerably better than last year's. It is considerably better than last year's. That's what I know. And that's what I know. It's better than last year's.
And I would not argue that. I would not argue against that. I agree.
And, yeah.
It's just that if I even had an inkling that we are getting close to having financials that work, I feel like we're flying the Alps blind, is what I feel like. And that's not fair to Kathy. That's not fair to her team. That's not fair to the people in this community. And my stance is, yes, it's painful. Yes, we're asking for more. Yes, we're saying that this needs to be, we need to look at this closer. But I'm doing it from the standpoint of trying to do the best we can in very bad circumstance. And I think that extra steps, whether they're painful or not, are necessary in this case. If we come to the point where we've gotten the best we can and we come up with a number, which we're going to have to come up with pretty quick, you know, I'm willing to live with that number. I just think that we have to take that extra, again, unique circumstances here, out of the box. Nobody's been here before. We're blazing new ground, but we have to look at it, and I just don't want to fall back to coming up with a number that has no meaning, that isn't backed by anything. So, but I do appreciate what you said.
I would suggest that while we're having this discussion budget, we need to come to conclusion a budget by the 17th of July, third Thursday of July. Okay, I would like to hear a proposal to have either budget hearings, budget session, or before the Thursday of July. We need to get together, hash this out, come to a conclusion so that we can get it submitted on time.
Well, let's ask Kathy when she thinks she can have a hearing.
Well, I don't have, let me look at my calendar.
I guess I'm unclear about what we're really asking Kathy to do, because if
None of the rest of us were participants in.
well, I
The rest of us
understand
haven't seen
that.
the proposed budget, Carrie. Only you guys have.
No, only
No, you
Nathan
guys
and
got
Kathy,
it.
yeah.
You guys got the one last.
From last month, yes, when and then we said,
be in
That one had
please
like
come back.
The
Not
budget's
much
in the.
different.
No, it's.
The budget, it is different. It is different. I would disagree with that.
We're talking about,
Okay.
you're not talking about the one that doubled the revenue of previous year.
Well, that
Is
was
this
the one.
This is the one that I
It's the last-
have been.
And it was in your packet, in your work.
It's in your-
Yeah, it's in the.
It's on the SharePoint.
It was
is what
on
we're
the
saying. Okay.
printout thing. Yeah. So I guess, I mean, if I was Kathy right now, I'm a board member, I don't really know what, I would be asking you, what do you want? If you want Kathy and her team to work on this for 2 more weeks, what do you want? What does this board
I'm
want
happy.
to see
So
change?
I'm very happy with the process Kathy has presented us and has documented.
Yeah,
Very
that's
happy
what she
with,
just said.
with what Kathy said they were going to do.
Well, that's what they did, and this is what they came up
That's
with.
not what they did. They based their data on faulty accounting data. They're going to look at data we can trust. If you
Yeah.
build a budget off data that can be
Okay, so I'm
trusted.
looking, I was confused that maybe I had the wrong.
I basically,
I don't.
I talked with John Gantner after our meeting. This is all I've really done much, except I did do an interview today. But I talking to John Gander, I am at least willing to work with him to try to figure out if the budget, basically have another set of eyes on it that's an expert to look at the budget to see if there's changes, because we're not gonna get to we're at an impasse. And so.
So
I'm
if
asking for a
Kathy,
second opinion, and that's what Kathy's offering to give us. is
and if
let's
John
pull in
Gantner
John.
comes back and says, this is good, is that what you're?
Let's pull in John and let's see what he gets. If the process is good, I can get on board with the result. My problem is the data in the accounting system, our auditors told us, do not trust it. We have seen its wild changes from month to month. My objection is to building it off of a faulty system that our auditors have warned us. It is irresponsible and reckless for us to trust until they audit. So if you will.
I do want to let you know, I have worked for a whole year with a faulty system.
I know. If you will just use data that's sound data and go through your process, then I can be okay.
Well,
with the
then let's
result.
look at dates. If that's what Ted suggested, so let's look at dates.
We're gonna have a date.
We have to have-
Whether we come to a conclusion or not, we gotta have a date.
Well, and we have to have that conclusion by the time we come to the date.
Well,
We're out of time.
I understand that.
So my question to you is, are you going to, and are you going to be able to accept John Gantner's recommendations with the work that we do with him at the time of the meeting? Or are we gonna need to have a set work session so that you can have some information and you can chew on it some more? Because you guys have done a lot of chewing on the data.
So I just want a second opinion from John. I trust John, and if you follow the process using good information from the bank account rather than faulty information from the accounting system, and you apply your process, I can be okay with the outcome. My objection has just been building a budget off wildly dangerous information our auditors told us not to trust.
Okay, so I don't know what John's getting surgery on his knee on the 10th. So I'm going to have to be able to work with him and have information back before the 10th, because he'll have surgery. And once he has surgery, I think it would be fair of us not to bother him. So. I don't think it's, I haven't talked to John, but I think the week of this 7th is sometime is when we should look at.
So are we gonna do a hearing and say we'll go with it, or are we doing or are we all getting together to hash this out some more?
Because the hearing advertising is gonna take, 3 days? Public notice.
We have to give, I have,
And we have to,
We have
if
to
you have
have-
a hearing, it has to be passed within 3 days.
We have to
If
vote
we
on
don't
it.
do it that same day, which most places do it that same day.
I think we have to give 48 hours notice for public hearing, right? The public hearing, I've got the paper here, but I'll look at it later. We'll make sure we meet the public meeting notice notification. I've got it in my little sheet.
24 or 8 hours, right?
No, not for the public
8
meeting.
hours for an emergency.
We just have to publish our budget within 3 days.
Publish it within 3 days.
No.
I've got that sheet.
We already did the publishing. We already met that.
We did with the one, but we have to actually, we actually have to publish the approved one to the state and stuff within 3 days from the public hearing. I've got it here somewhere.
Where are you looking?
I should have put it at the top. Actually, I'll let you guys figure it out.
Are you looking at this?
Yeah, I'm looking at that.
So we have 3 days after we have the hearing, we have to vote on it. So it has to be done by the 17th. It'd be nicer to have it done by the 10th.
Hearings for special district budgets shall be conducted not later than the 3rd Thursday in July. The governing board of any special district may choose to hold the budget hearing in the conjunction with the budget hearings, county budget hearings, and so advertise, which we didn't do. We didn't do it along with the county. Within 3 business days of the conclusion of the public hearing, the governing board of special district or other specified entity shall adopt the budget. Certified copies of the adopted budget shall be on file in the office of special district and other entities, which includes the state, by the end of July. Basically, we have till the end of July to publish it, get it to everybody.
You get it to the city.
Yeah.
So
If we would meet sometime around the 7th or 8th, that would give us a little bit of, it's a couple days before John's for sure gonna be, it would just give a little buffer everywhere.
So Monday or Tuesday, Monday the 7th, Tuesday the 8th. Which day do you want?
I can do either.
Either one's fine with me.
Could we have it in the evening? Early evening?
Yes.
Like 5:30-ish again?
Yeah, early evening. Even 4:30 would be.
But if it's a public hearing, then it needs to be.
If you're doing that, I don't trust you guys to be ready for the public hearing. I'm gonna.
Well, that's
be
why I
honest.
think if we do it the 7th or 8th, then we could have the public hearing the
Well,
10th or
let's
11th, that would
Yeah.
be, and that would still be in
I would
plenty of
agree with
time.
you on that.
Let's schedule both at the same time.
Yeah.
So let's just figure right now which day we want to do the hearing and which day we want to do the.
Cause you have to have, in my opinion, if you have the public hearing, you might as
well vote on it.
Vote on it, but I don't know that you guys can do that, cause I don't know how far apart
So
things
you
are
want a
gonna end
work
up.
session and then a public hearing?
I wanna go to a meeting where we can all agree on the budget and we can move forward. So if that takes the work session, then that's what I want, but if it can be done, because people are gonna trust what comes about, because John Gantner's at it, then I can deal with that, but I just want it to be one or the other. If we're gonna be far apart, and I don't know how I'm gonna feel about it because I haven't seen it yet. I trust John, but I haven't seen it yet, and in fairness to myself and my team, I wanna try to make sure that I feel comfortable with it too.
let's have a work session on the 7th.
Yeah.
At 5:30. And let's have a public hearing Thursday at 5:30.
And that would be the
That would
10th.
be the 10th.
I'll just throw something up so that we got something to look at.
That's a good job.
At 5:30?
At 5:30. And we could have the public hearing a little later. It is a public hearing. We won't be here long. That's the only thing we discuss.
Well, except that, I would assume we would have a special meeting after to vote. Otherwise, we have to come in 3 days later.
Yeah, you need to have a special meeting to vote.
Well, let's just call a special meeting on that.
So we have a public hearing and then however long the public hearing lasts, half hour is what they generally last. And then have the special meeting after it to vote yes or no.
Normally ask for public comment 3 times, and if no one is here to answer that public comment, you close the
Well, I
public
think
hearing.
you have to,
move on vote.
but you have to do the presentation, whether it's in public here or not. At least we always have.
Well, you
have to do the.
you have to have that, we would have it proposed, hopefully a proposed budget before us on the night of the 7th.
That's why the proposed budget will be in front of you on the 7th. I just don't know whether you guys are gonna agree. That's my
Okay.
biggest thing.
Yes, I understand.
So then on the 10th, we could have the public hearing and the special meeting same
Right,
time,
and it
right?
still gives you a little bit of almost a week to, if we fall apart, that you still have to work with.
Okay.
So
Is
that one at 5:30 also then? We're gonna do the public hearing at 5:30 and meeting to follow?
And the
Is
special
that-
meeting at 6?
Yeah, special meeting at 6 after the hearing on the 10th.
Okay,
Well, usually,
the 10th at 5:30.
You could do it at 5, the public hearing, if you wanted it to be.
At 5. and the
5:30
special
your meeting.
At 5:30. Okay,
usually you come to a conclusion on what your proposed budget is going, or what your budget is going to be, and you present it to the public. And what that's for is that they would give comments. So we should have, and then we would vote
So
on
at this special meeting, we will ask for comments.
it. Okay.
Yeah.
Okay, so that,
So Madam Chair, what I would recommend is that you schedule the meeting as a special meeting for both of those. That you open the special meeting on the 10th and then adjourn the meeting and move into the budget hearing. Hold the budget hearing and then move back into the public meeting and then you can vote. And so schedule it all starting at either 5 or 5:30 and have it sequentially that way.
So we open the special meeting at 5.
Sure.
Say hello, we're all here, then we have the public hearing.
Adjourn into the public hearing, yep.
Okay. And then go to.
Rejoin
and
the
then-
public meeting.
Okay. At 5:30-ish. And
Yeah, whenever you get through the public meeting, the public hearing. The reason for it is, as was stated, is to allow public comment on your budget.
right, okay.
Thank you.
And during that time, during the public hearing, Kathy presents the budget, correct?
That's correct.
Okay. All right, thank you, Allison.
So that doesn't have to be really detailed.
Yeah, I know.
It's, just a basic, the upcoming budget.
So the work session is gonna be at 5:30.
On the 7th.
Right.
On the 7th, okay.
And we'll be here at 5 on the 10th.
Okay.
So we'll start.
Yep.
I'll try to remember all that.
And hopefully, the 7th will be a short meeting.
Yeah.
So I want to.
Thank you for your consideration. Did we, when we came out of executive session, did you say that there was no motions, there was no actions taken?
Did not say that.
5
Okay.
PM on the 7th.
So that needs to be put in.
5:30 on the 7th, 5 on the 10th.
So I think somebody should, all right, we need to acknowledge that there were no actions taken during the
Executive session.
executive session.
So,
And I thought me just saying that.
Yeah, I'm guessing just puts it in the minutes and.
Yes.
We have, looking at our agenda,
CEO report.
Let's see. So the CT update is just that we're moving along on our projects with all of our various entities like architect and the state and everything's on schedule. We are gonna have CT available during our time, but there'll be a couple of days with the transition that we won't have CT and we'll have to go on diversion, which we hate, but it's not gonna be the whole month, so we like that part. We have worked out a way so that we can still have MRI as well. So we won't be losing our MRA at the same time as we're trying to do the CT project, which brings in extra dollars. And we're afraid to not have MRI for 1 month and people thinking that we don't have it any longer. So we're trying to make sure we keep it in place. And next week we're going to be interviewing the clinic manager. I've interviewed her a couple, 3 times and I've had many applicants and many of them not qualified. So, she I do feel is the best candidate. I've talked with the staff over there. They're gonna meet with her and there's gonna be discussion and, I've told you guys a little bit about her, but she'll be here next week. The HR director that we had 5 people that we were looking at. We were gonna take it down to 3 and just by processes of kids that don't want to move because of high school and things like that, we ended up with one of the candidates that was viable. To be able to come out was not my ideal, but she did meet the threshold to be coming in for the interview, so she did come into the interview. And we also had her do a presentation to the managers besides their interview too, and she spoke about leadership and what leadership is and did a presentation for them. So we've kind of tried to up the stake on the questions and the pieces that we're doing. Her name is Mary Elizabeth Mullins, and we are collecting data electronically from our staff on their feedback relative to their pieces for her. So I can't say to you right now what the direction is on her, whether she will be the candidate or we'll have to go back to the drawing board. The Medicaid updates that I didn't put on here, but I would like to make sure I let you know is that Medicaid, if it goes forward the way that it is in the big beautiful bill, there will be cuts to the people that are eligible for Medicaid, which will impact bad debt and charity care. And we should just know that because people that would normally qualify for it will not. Our charity care, we go above the federal poverty level anyway, just to be able to give people a little bit more room that have families and stuff. But that could impact some of our Medicaid numbers. We did get a Medicaid both for the swing bed and hospital side and the nursing home side, and they came back with the same dollars. They did increase our fees so that we get a daily fee so that we get $274.56, I think is what it is. And we were at $253 or something like that. Not just as a side note, I contributed independently to the WHA PAC committee because I feel like it's going to be a very important time for us to be getting representation that we need for lobbying for the things that could really impact a rural hospital quite severely with some of the things that is going on. So that's really my report.
Our foundation meeting is tomorrow. So they did have the golf tournament, but I don't have any information yet on any of that because we're meeting tomorrow. So
we didn't have a quorum. We had a meeting last month, but we didn't have a quorum.
Yeah, a couple people came, but yeah, they didn't have a quorum, so they didn't hold an official meeting, but they just kind of updated on stuff. So anyway, I'll have update on the next one.
So do we want to schedule a bylaws meeting?
Yeah, I would say wait for the budget to get done.
Maybe we can postpone that to next month and see when budgets. By the way, so next month also, we
were gonna talk about doing strategy stuff.
Well, and are we meeting next month on the 17th or the 24th is the question.
Oh, you
Because
wanna
the
change your
third Thursday is the 17th. There's 5 Thursdays in July, so. Just didn't know.
You could, I don't know how to say this for sure, but you could have your regular meeting a week early. I don't know if we can do that with finance committee.
You mean the regular meeting?
Because you guys are gonna come a lot if you.
The regular meeting is the 17th.
And that's when we have to, that's the final date that we have to be able to get the budget passed too. So,
That's the
okay.
final date for the public hearing.
Yeah, okay. The 10th, yeah. So we settled on the 7th and the 10th, so hopefully we'll be done, and then the 17th is the meeting, yeah, okay.
So we are on the 17th for sure, okay. Just wanted to double check.
The 17th will be finance.
The 15th will
Oh,
be
15th.
finance, yeah,
Okay.
Tuesday, and then the 17th is Thursday, so that will be the regular meeting.
I tell you, my
Which
phone
would
doesn't
make
have a calendar.
quality, is quality still on Wednesday?
And that, when's Quality's next meeting?
The second Wednesday, so it'll be the
What?
July 9th at 4.
July 9th?
Yeah, cause the first is.
We changed it to the second Wednesday. Make sure I'm not lying to you.
Yep, you're right.
Do we have to have a motion to just table the bylaws revision meeting? No, just, okay.
I just put it on there so that we could talk about it. Okay, so is there anything else we need to talk about? So I would entertain a motion to adjourn.
Madam Chair.
In a second,
I'll second.
all those in favor of adjournment, say aye.
Aye.
All those opposed, same.
Okay, so thank you very much, and see you soon.